this critical appraisal of fixed drug combinations of marketed preparation essentially has to be employed when there are multiple drugs which are incorporated in single formulation. Okay. Now, whenever these formulations, which are called as multi-drug formulations, okay, they have to be critically analyzed for their rationality and irrationality. Now, what this two term means, okay, rationality and irrationality. Rationality means there is some solid reason or there is a particular logic behind incorporating these particular medicines together, okay, and irrational means that there is no reason as to why these drugs have to be combined together, okay. Now, how we are going to judge whether the said fixed drug dose or drug combination is rational or irrational, okay. For that, we have to analyze certain critical parameters, okay. Now, for these critical parameters, we are going to take in consideration the indications for which the FDC is given, the dose, route of administration of drugs, justification of inclusion of each ingredient along with its adverse reactions, its contraindications, precautions, and some special instruction for the patients who are going to use this particular FDC. So by analyzing these particular parameters, we are going to ultimately say that whether that particular fixed dose or drug combination is rational or irrational. Okay. Now, what is, before starting with the FDC, firstly we are going to analyze what exactly is rational use of drugs. Okay. Rational use of drug means the patient is going to receive right drug by right route, by at right dose, okay, to meet their clinical needs. Okay, means the doses that meet their own individual requirements for adequate period of time, and most importantly in that, the cost of that particular medication should be as low as possible for patients and community to accept. Okay. Now, rational or irrational use is the use of medicine in a way that is not compliant with rational use, as we have seen above. Okay. The use of too many medicines for a particular patient is known as polypharmacy, and that polypharmacy is one of the common types of irrational medical uses. Okay. Means unwanted drugs are dumped into the patient which are not clinically required for that patient for that particular disease. That is called as irrational use of that particular medication. Okay. So now we are going to see what exactly is the aim of this particular analysis of FDC. Okay. Now, firstly, we are going to see what exactly is FDC, what are its advantages and disadvantages, what criteria of FDCs has to be prepared, and also we are going to see certain examples of rational and irrational FDCs. Okay. Now, firstly, let us understand what exactly is FDC. Okay. As per WHO, FDC means it is combination products. Okay. These are combination products, also known as fixed dose or drug combinations. Okay. It may this is you may use as fixed dose combination or fixed drug combination. Okay. Now, what are these FDCs? They are combination of two or more active drugs in a single dosage form. That is called as FDC. Two or more active drugs in a single dosage form. Okay. Now, whenever you want to prepare a FDC or whenever you want to combine two or more drugs, there are certain criteria which have to be achieved. Okay. Then only you can use that particular drug in combination with other drug. Okay. So the first criteria for any FDC is that whatever active ingredient or individual drug which are to be combined together, they should have different mechanism of action. Okay. So that is why when we studied this penicillin or this antibiotics, we took some FDCs in consideration. Okay. Say for example, whenever you are going to combine beta-lactam antibiotics with clavulanic acid, sulbactam or tazobactam. Okay. Now in that you can see there are two drugs. One is beta-lactam antibiotic, maybe a penicillin or cephalosporin. Okay. And it is going to be combined with beta-lactamase inhibitors. Okay. That is clavulanic acid, sulbactam and tazobactam. Okay. Now, as you know, the beta-lactam antibiotic, that is cephalosporin and penicillin, they have different mechanism of action to kill a bacteria, whereas the beta-lactamase inhibitors, they have different mechanism. Okay, they are not going to kill bacteria. Rather, what is going to happen? They are going to work as suicide inhibitors. Means whatever beta-lactamase is produced by that particular bacteria, rather than degrading the beta-lactam antibiotic, it is going to attach to the beta-lactam inhibitors. Okay, and your penicillin or cephalosporin is spared from the metabolism, due to which the viability of the penicillin or cephalosporin is automatically going to increase, right? So here we have seen when two drugs are combined together, their mechanism is totally different because the targets are going to be different, right? Now the second is that there should be little variation in the pharmacokinetics. Means they should have similar rate of absorption, similar rate of distribution, similar rate of metabolism and similar rate of excretion. What will happen if the pharmacokinetics change? Okay, say for example, one drug is absorbed within 5 minutes and the other drug is absorbed after 1 hour. What will happen? The drug which is fastly absorbed is going to show its effect alone because the second drug has not been yet released. Okay, it has not been yet absorbed. Okay, so there is no logic in using this particular combination because the kinetics are going to different. Right, the T half should be similar. Okay, so that is why means both of the drugs, in short it means both of the drugs are going to remain in your systemic circulation for a given period at similar rates of its ADME. Right, so that is why that these two drugs are going to behave pharmacokinetically similar, and then they are going to show its pharmacodynamic activity. Okay. Now third is that whenever you are going to combine two drugs together, they should not have supra-additive activity. Means it should not be like that just 1 + 1 is equal to 2. It is not going to help. 1 + 1 here it has to be 11. Means one drug has to supplement the other drug to increase the potency more than its individual concentration. Right? Then only that particular FDC will be of any use. So whenever you are going to combine the FDCs together, these three parameters have to be strictly followed. Okay. Now there are certain demerits of the FDCs. Okay. Dose alteration of one drug is not possible without alteration of other drug, because as we have seen, as the pharmacokinetic parameters have to be similar, you cannot alter the doses of individual drug. Okay, that is why it is called as fixed dose combination. The dosage is going to remain same. You cannot alter. Say for example, I want to decrease the dose of one drug and increase the dose of another drug. That cannot happen. Okay, that is not allowed. That will not happen in this particular case. Next, differing pharmacokinetics of constituent drug pose a problem for frequency of administration of the formulation. Okay, say for example, as I told you, one drug is getting absorbed and eliminated within 1 hour, and the second drug is going to get absorbed and eliminated after 5 hours. What will happen? As there is different pharmacokinetic parameters which are to be taken in consideration, the dose administration is going to become a problem. The first drug is going to get eliminated from the body quickly, so that particular drug has to be repeatedly administered. Whereas the second drug, as the clearance rate is decreased, right, so the rate of frequency of administration has to be reduced. So that cannot be possible. Okay, and the third is that naturally when you are going to use 2 or more drugs simultaneously, of course it may increase the efficacy, but simultaneously it is also going to increase the chances of adverse drug reactions and its toxicity. Right? So maybe the efficacy will be high, but accordingly that the toxicity will also be high, which is again going to impair the health of that particular patient. So in such cases, one has to avoid the use of FDCs. Okay, so now how we are going to study exactly the critical analysis of FDC. Okay, now say for example we are going to take one preparation, that is amoxiclav, combination of amoxicillin and clavulanic acid. Okay, the brand name, there are so many brands which are available. Say for example we are going to take Clavon 365, that is the brand name. Okay, and you know, whenever you purchase a medication, there is a label claim given on that particular medication. Okay, for example, this particular medication contains dash dash milligram of amoxicillin and dash dash milligram of clavulanic acid. Okay, so that is the label claim. Then type of preparation, naturally as you know, it is a tablet. Okay, then route of administration being a tablet, it has to be taken orally. Manufacturing date will be there, expiry date will be there, batch number will be there, and also the cost as per formulation. One tablet is going to cost this much rupees. Okay, and lastly we are going to see who is the manufacturer. So once you have selected a particular FDC, okay, say for example we have selected Clavon 365 as our target FDC. So what we are going to do, we are going to write down all these parameters. Okay, then we are going to select that FDC for our further studies. Okay, so the first thing that we are going to analyze is use of the FDC as per the claim. Okay, now if you see, there are certain medical literature available called as SIMS and MIMS. Okay, these are used by the practitioners, medical practitioners, as well as the person who is dispensing in the pharmacy. Okay, whatever marketed formulation of that particular drugs are there in the market, that data will be present in the SIMS or MIMS. SIMS means current index for medical specialties. Okay, so in that you have, say for example, how many combinations by different companies are available for amoxicillin and clavulanic acid. There will be hundreds of combinations by different companies. Okay, so you are going to have entire data in that particular book. Okay, and there you will find that this particular FDC is used for treatment of such and such infection. Okay, that is what is called as observed claim. Okay, that is what has been given by medical literature, that it is being used in treatment of bacterial infection. Okay, now you have to analyze by using various study material or literature or your books of pharmacology. You will really come to understand that really whether the amoxicillin and clavulanic acid is used in combination to treat certain bacterial infection, if at all, which kind of bacterial infection are to be treated by using this particular FDC. That is what you are going to write in related facts. Okay, and then in the remarks with reason, you are going to say that if the observed claim and related facts are exactly same or they are relevant to each other, then the FDC, the claims of the FDC are to be accepted. Okay, that is the remarks with reason. Next, we are going to justify the dose and route of administration with critical comment giving reason. Okay, say for example, whether that drug has to be taken prophylactically or whether it has to be taken at therapeutic dose level, and what should be the route of administration. Okay, for what particular condition. Say for example, for a particular condition, that particular drug can be given orally. For another condition, the same drug can be given intravenously, right? So as when the this oral formulation has to be given, when the parenteral preparation has to be given, okay, that particular thing has to be discussed here. Next, we are going to discuss this pharmacokinetic parameters of every individual drug which is incorporated into the FDC. Okay, then we are going to discuss different preparations or formulations of FDC, whether it is available as a tablet, whether it is available as a capsule, same is available as a syrup, suspension, etc., or it may be available as a parenteral. Okay, so here again is the same thing: observed claim, related facts, and remarks with the reason. You have to write down after you discuss or justify the dose and route of administration. Next, why that particular individual drug has been included to formulate that particular FDC. Here we are going to discuss the mechanism of action of each ingredient, okay, and then we have to justify whether there is any rational reason behind combining these ingredients to form a FDC. Okay, same thing you have to write. You have to write down the observed claims, related facts, and remarks with the reasons. Next, we are going to see adverse reaction. Again, here we are going to see adverse reaction of individual drugs and adverse reaction of the FDCs. If the FDCs shows more reactions, adverse drug reaction than individual drugs, means here we can say that there is no logic behind combining this particular drug because the chances of ADAs have increased. Okay, even though it may be therapeutically beneficial, but you cannot cause any harm to the patient by increasing the adverse drug reactions. Then contraindications. Okay, again we have to discuss what are the contraindications. If at all they are present, why that particular contraindication is there for that particular FDC. Then the most important again is that your drug interaction. Being multiple drug combination, there is bound to be some kind of drug-drug interaction, drug-food interaction, or any kind of different kind of drug interactions. Okay, so what is, then you have to analyze what kind of drug-drug interaction it is going to show, what kind of drug-food interaction it is going to show, and different kind of other interactions have to be discussed. Okay, then what are the precautions to be taken whenever a patient has to be given this particular FDC? That point again has to be discussed. Okay, then special instruction for the patient. Okay, say for example, if a person is suffering from any kind of liver damage or kidney damage, then we have to analyze that one of the ingredient should not be given to a person having liver impairment or kidney impairment. So in that case, you should say that this FDC will not be suitable for that patient because one of the drugs is primarily metabolized by liver and the patient has a liver problem. So primarily that drug will not be metabolized and it will remain inside the systemic circulation for a longer period, changing its pharmacokinetics, changing its pharmacodynamics, and it may result in particular kind of adverse drug toxicity. Okay, so that particular instruction has to be given. Okay, then the last, as we have seen, the cost of FDCs. Okay, logic is that whenever you are going to combine two or more drugs, naturally the cost of the medication is going to increase, right? But say for example, XYZ company has that particular combination for 10 rupees and ABC company has that particular combination for 20 rupees, then you can say that the selected FDC is available at 20 rupees, but there is another company which is providing same medication for 10 rupees. So rather than using this particular medication, use this particular FDC which is going to cost low. Okay, so these are some of the parameters which have to be discussed during critical analysis of FDC. Okay, so ultimately then we are going to summarize each and every data and we are going to write the reason whether that particular combination of FDC is rational or irrational, giving a particular reason. Okay, say for example, the two drugs have different mechanism of action, two drugs have similar pharmacokinetics, and their combination is going to enhance the bioavailability more than its additive effect. So that is why this particular combination is a rational combination or irrational combination, depending upon your results. Okay, so here we are going to see one example. Okay, so we are going to now see one example of FDC containing Carbidopa and Levodopa. Okay, and the brand we are going to choose is the Prakimet, which is being manufactured by GSK Pharma. The Carbidopa contains 25 milligrams, Levodopa contains 100 milligrams, which has to be given thrice a day. Okay, and the type of preparation is tablets, and there will be some manufacturing date, expiry date, batch number. The cost of tablets of this particular formulation is 59.85 rupees for 10 tablets. Okay, so once we have selected the FDC, now we are going to see the claims. Okay, the Sims or Mims says that this particular combination of carbidopa and levodopa, it is to be given for patients suffering from idiopathic post-encephalitis Parkinsonism. Okay. Now, firstly, you should be able to understand what exactly are these terms. Okay. So, what is Parkinsonism? It is a chronic progressive disorder of CNS, which is the result of damaged cells located in the basal ganglia of the brain, and it is characterized by kinesia, rigidity, and tremor. Now, what is the word of this idiopathic? Idiopathic means something of unknown origin. We do not know the exact cause. That term is called as idiopathic. Okay. Now, what is this post-encephalitic Parkinsonism? Now, this is the Parkinsonism which develops after viral illness that triggers degeneration of nerve cells in substantia nigra. Okay. And then it is going to result in overall degeneration of the nerve cells, and which is going to clinically present as Parkinsonism. Okay. So, from this part you will come to know, yes, the levodopa and carbidopa, exactly both of the drugs have been implicated, are clinically used for treatment of about said claims. Okay. So the related facts, okay, both the drugs are used in Parkinsonism, and this combination is useful in Parkinsonism is going to be a remark. Now the next, justification of dosage and route of administration with critical comment giving reason. Observed claim against is that carbidopa and levodopa 100 milligram orally has to be taken after meal. Okay, that is the given fact. Okay, now you are going to relate the facts. Okay, now levodopa is available in tablet formulation as well as capsule formulation with a dosage of 100, 250 and 500 milligram. Okay, levodopa is well absorbed from the GIT by amino acid transport system. It is rapidly metabolized by GI tract and the liver with the help of enzyme dopa decarboxylase, which converts levodopa into its active form, that is dopamine and other amines. Okay, that is what we call as peripheral decarboxylation. Then this levodopa, it is excreted in the urine either in unchanged or conjugated form with glucouric acid or sulfates. Okay. Then the second drug, carbidopa. Now, what is the use of this carbidopa? The pharmacology says that it is going to inhibit the peripheral decarboxylation process of levodopa, means before it reaches the brain, levodopa will not get converted into dopamine. Thus, the entire concentration of dopamine can be achieved inside the brain. Okay. So, ultimately, this sentence is that concurrent use of the drug reduces the required dose of levodopa by 70 to 80% and increases the plasma T half. Okay, so if you plainly give dopamine, what will happen? Out of 100 milligram, only 30 to 20 milligram is going to reach actually the brain. Remaining 70 to 80% is peripherally metabolized before it reaches the brain, right? So you can imagine how much more amount of actual dopamine has to be given. Okay. But when you are going to combine carbidopa with levodopa, what is going to happen? Carbidopa is going to prevent, or it is going to make sure that levodopa does not get metabolized before it reaches the brain. Once it reaches the brain, then in brain the levodopa is going to get converted into dopamine, and then the dopamine is going to control the Parkinson's symptoms. Okay. So the next fact is that we have seen that take the tablet before meal. Okay, here we have seen one wrong sentence has been taken. Take after meal, that is the observed claim. But our study says that take this combination before meal, because as protein are ingested in form of milk or any other form, it may produce sufficient amount of amino acids which competitively affect the L-dopa transportation inside the GIT and inside the brain. So, if you consume this particular combination of protein and combination of this levodopa and carbidopa, the transportation of this levodopa and carbidopa may get impaired. Okay, so this is one thing we have observed, and that is what we are going to write down in the remark. All the observed claims are correct, except that indication that to take the tablet after the meal. Okay. Next, justification of inclusion of each ingredient. Okay, So as we have seen, dopamine itself cannot cross the blood-brain barrier, so it has to be converted into the prodrug form, that is the levodopa. So levodopa is a precursor of dopamine. It can cross the blood-brain barrier, where again it is decarboxylated to dopamine. Okay, if administered alone, actually, unfortunately, only 1 to 3% of levodopa actually enters the brain unaltered, which is not sufficient to treat the clinical symptoms of the brain, because 97 to 99% of levodopa gets metabolized extracellularly by various enzymes to the dopamine, okay, which cannot cross blood-brain barrier. Okay, substantial degradation occurs in GIT and peripheral tissues by dopamine decarboxylase. Other pathways for levodopa metabolism are through catecholamine O-methyl transferase, that is simply called as COM, or MAO-B, that is monoamine oxidase B enzymes. Now this carbidopa is a peripheral dopa carboxylase inhibitor which prevents conversion of L-dopa to dopamine outside the brain and minimizes the side effects. This allows a greater fraction of L-dopa to dopa to cross the blood-brain barrier, producing higher dopamine levels in the central motor regulatory areas. And carbidopa itself does not cross the blood-brain barrier and hence does not interfere with conversion of L-dopa into dopamine in CNS. And the remark we are going to state that it is rational to administer carbidopa and levodopa as FDC, because one drug is going to decrease metabolism of other drug. Okay, then ADRs. Okay, ADRs, as we know, the observed claim is going to say that it is going to cause GI disturbances like nausea, vomiting, anorexia, may result in orthostatic or postural hypertension, cardiac arrhythmias, or psychiatric symptoms. Now, why these particular adverse drug reactions are going to occur, we have to again investigate. Okay, now this hypotension may be due to release of dopamine into circulatory system after peripheral decarboxylation of levodopa. Okay, cardiac arrhythmia may occur due to stimulation of cardiac alpha-1 and beta-1 adrenaline receptor by dopamine. Psychiatric symptoms like depression without suicidal tendency, abnormal involuntary movements, or dyskinesia, delirium, and hallucination have been reported. Okay, then again in the liver there is slight elevation of liver enzymes, and it also results in leukopenia and thrombocytopenia. Means whatever observed claims says these are the adverse reactions stated with this combination are all totally correct. Okay, so we are going to say the remarks observed are proper. Then contraindication. It says that it should not be given to the people having lactation, people having narrow angle glaucoma, melanoma, psychosis, renal or hepatic disorders. Now, why it is to be not given to the lactating women? Because levodopa is distributed inside the breast milk. Okay, so it may also get incorporated into the milk. Okay, so that is why generally it is not recommended to give this levodopa carbidopa combination to the breastfeeding woman. Now, why it is to be not given to the narrow angle glaucoma people? Because it may cause mydriasis and may cause attack of glaucoma. Now, why in melanoma? As levodopa, as you know, it is a precursor of skin melanin. Psychosis, as you know, it increases the dopamine activity in the brain, which may precipitate into schizophrenia-like syndrome. Okay, and in renal and hepatic disorder, as this particular enzyme levels are increased inside the liver. So, in the remark what we have seen, whatever given claims are there, they are exactly correct. There is no alteration in it. Okay, there is drug interaction. It says that vitamin, you should not be given in this combination with vitamin B6, MAO inhibitors, or tricyclic antidepressants. So why it should not be given with vitamin B6? Because it enhances extracerebral metabolism of levodopa and decreases its therapeutic effect. Problem with MAO inhibitors is that it potentiates the toxicity of levodopa, which may result in hypertensive crisis. Problem with tricyclic antidepressant is that it decreases absorption of levodopa, okay, which may again result in hypertensive episodes. So remark is that reported drug interactions are proper. Okay, and precautions other from the drug interaction, we are going to say that it should not be given to patient having heart problem, liver diseases, having mental problems like dementia, psychosis. It should not be given in pregnancy and elderly and heart patient. Okay, so this is what we have seen. Okay, And the last is the cost comparison. As I told you, this particular combination is available at 59.85 rupees, but the same combination by made is available at with 24.15 rupees, right? So here you can say this particular combination is a bit costlier combination. So alternatively, this combination that made by this marine pharmaceuticals can be used as it is cheaper. Okay. So lastly, we are going to and see before that special instruction to the patient, whatever we have seen, that take the tablet before meal as it is going to. We are going to summarize everything. Okay. Take the tablet before meal as the protein ingested with the milk may produce sufficient amount of amino acid, which is going to impair the transportation of dopamine, and consult the physician if required. Okay. And the final remarks. As per the discussion, the FDC of Carbidopa and Levodopa is a rational combination because first, mechanism or mode of action is different. In presence of Carbidopa, the concentration of Levodopa is increased in the CNS. The dose of Levodopa is also reduced when you are going to use in combination. Very few adverse effects are observed even in the combination. That is why, and all the observed claims were found to be true. So this particular combination is found to be a rational combination. Okay. So these are the parameters which we have been utilized to study whether this particular combination was rational or not. Okay. So this is how we are going to analyze different kind of FDC. Okay. So here are some of the examples of rational dose combinations. Okay. So mostly you will find these classes are from antibiotic class. Okay, like we have seen amoxicillin and clavulanic acid. Then most commonly rational combinations are the anti-TB drugs like rifampicin, isoniazid, pyrazinamide. Then you got rifampicin, isoniazid, ethambutol. Then multiple drug combination which is used in MDR-TB, that is rifampicin, isoniazid, ethambutol plus pyrazinamide. Okay. Then this particular drug we have seen sulfadoxine and pyrimethamine, which is an anti-malarial combination. Okay. And most commonly are your oral rehydration salt powder, which contains calcium, magnesium, and so many other things along with glucose. Okay, near about 10 to different kind of minerals and other drugs are there in this combination. Okay, so this is one part we have seen, that is rational FDC. Okay, and in the coming part we will also see one example of irrational combination. Okay.